welcome to this second session of what we know as the human experience. Now, human experience is actually a collaboration between LifeAd and the Ninja facilities. And I'm going to introduce myself a little bit before we start on. So I'm Andrew, and I'm based in Singapore from the LifeAd team. And the purpose of the my role in LifeAd is actually to design medical benefits. And yep, this is how I look like in terms of, if you're wondering how your medical benefits and the mental health benefits look like, I am the one. And of course, we work together with the PIPS team to roll out the medical benefits. But beyond that, we also would like to increase the collaboration and the communal, internal community building process as well. So together with the Ninjas facilities, we decided to actually roll out this initiative known as the human experience. Now, some countries would have the community day. Today in Singapore, we are having the community day. In other countries, they might have the community week, and the purpose is to actually build internal community through some of the events that we have. Now, today, one of the topics that we're going to talk about is on health and well-being related to your skin. And we know the skin is a very intimately important clothing of our body. It is natural, but we also need to take care of it properly. And it is actually our honor to actually have Dr. Ngiam, to come in and actually guide us and give us some quick tips on how to protect your skin, but more importantly, how do you actually take care of it, and so that you will look naturally good. All right, so Dr. Ngiam is the founder and medical director of J Laser and Aesthetics Clinic, and that is actually based in Singapore. He obtained his medical and surgical degrees from the National University of Singapore. He has particular interest in the area of combination therapies in the area of aesthetic medicine, particularly with the use of energy devices, Botox, dermal fillers, and thread lifts. And I think these are some of the topics that you would like to know more about. More importantly, do they work, right? And how do they work? So without further ado, let me actually introduce Dr. Ngiam on stage. Let me have Dr. Ngiam, please.
Okay, first and foremost, thank you, Andrew, for the very kind invitation. Actually, Andrew and myself classmates in NUS. That's how I managed to come here to present. So my topic for today would be skin health and aesthetics. In general, there's a lot of information that is on the internet, and it's not verified. And you should actually ask a practitioner of skin health, either an aesthetics physician or a dermatologist, to confirm some of this information. So without further ado, let's proceed. So the agenda for today would be, number one, your skin. Why is it important? This is actually the most important slide. We will explain to you the concepts of what are the functions of the skin, what does it do beyond just being a cover for your muscles and ligaments and all that. Skincare, how do we keep it simple? There are tons of skincare products out there, but what actually works and what else is actually used as an additive? And common conditions that I see in my clinic all the time, such as spots, zits, and scars, what works and what doesn't. We'll be going through some of the common aesthetic procedures that I do on a daily basis, and we'll end up with some aesthetic tips. So, first and foremost, what is your skin? What exactly is your skin? It's actually the largest organ in the body, covering about 20 square feet. And it has multiple functions. Number one, it protects against microorganisms, and also the elements such as sun rays and UV damage and excessive water loss. And it also regulates the body temperature so that you don't overheat. You can see a lot of these, example, NS boys, those who do the army, they don't sweat that much, they overheat, they go into heat stroke or heat shock. And the production of vitamin D, which is actually very important for the absorption of calcium. And it gives you the sensation of touch, protects you from heat and cold, as well as it has some immune functions as well to destroy harmful microorganisms that might want to cause damage to your skin. So there are three basic layers, the epidermis, dermis, and hypodermis. I won't bore you with the specifics, but the most important layer is actually the dermis, which is the sandwich layer. So why is it the most important? Because it contains many very important structures: blood vessels, nerve endings, sweat and oil glands, and hair follicles. So there are a lot of treatments that can be targeted in the dermis to help you to improve. For example, just a few, Botox injected in the skin can actually reduce the appearance of pores because it causes the muscles that are causes goosebumps to contract, so your pore size reduces. It can also reduce oil of the face. If you find that your T-zone is extremely oily, it's actually very useful to help to reduce the oil by inactivating and suppressing the oil glands. So these are some of the uses of the aesthetic treatments that we do. So, skincare. So this is a topic that I get asked very often in my clinic by all patients. Doctor, what should I do? I have tons of skincare. I open my cabinet, there are 20, and they're all half bottles, not finished. So I have to explain that it is better to keep it basic. And the three main basic skincare elements you should have would be a good cleanser, a moisturizer, as well as a sunblock. And I will give you a brief explanation of what constitutes a good cleanser, moisturizer, and a sunblock. So start off with cleanser first. It should be water-based, meaning it shouldn't clog your pores. So things like Cetaphil, Physiogel, these are all water-based. They have water-based versions of the cleanser you can use. Personally, I would like to advocate things like Cetaphil AD Pro AD Derma. It's actually quite good for sensitive skin, as well as you can also use it for oily skin as well. It should have minimal preservatives. If you turn over to the ingredient side, you can see there are a lot of parabens. Butyl paraben, butyl paraben, methyl paraben, etc. These are all preservatives. So these allow the products to sit on the shelf for a long time before they get sold. But these are exactly the products that cause what we call irritant contact dermatitis, sometimes in patients with sensitive skin. Artificial coloring, if it looks good, it smells good, it's probably bad for your skin. Okay, so a lot of good things are not good for don't smell good or don't feel good. Okay. Okay, moisturizer, skin type, dry, normal, and oily. You can use the different viscosity of the moisturizer. For example, if your skin is very dry, you can use something that is richer. So things like an ointment. If your skin is very oily, you can use things that are a bit more watery, a bit less dense, such as lotions. And the area of the body, for example, for face, we tend to use lotions, and for body, we use creams. So this is the most important slide and the take-home message for today. What constitutes a good sunscreen? So if you go to your aesthetic physician or you go to your dermatologist, they will tell you what is the most important. Sunscreen, sunscreen, sunscreen. So what constitutes a good sunscreen? First and foremost, we have to understand this term, elusive term called SPF. So does anybody know what SPF stands for? It's actually sun protection factor that denotes protection for UVB rays. So the sunscreen should have these following characteristics. For example, it should be water resistant. Can you imagine your friend who eats laksa and it perspires like mad? You know, the sunscreen will probably wash off. Okay, and those people who like to do water sports, if you do swimming and all that, if you don't have a water resistant sunscreen, everything will wash off. Okay? It should be SPF 30 and above. Okay, the reason I will explain the next slide. Because beyond 30, the sun protection actually plateaus. So we would recommend SPF 30 and above. There are two kinds of ultraviolet light, UVB and UVA. UVB is the one that causes most detrimental skin conditions. So this is what SPF protects against. And if you look at for example, I put a Cetaphil day-long picture, you can see that it says SPF 50. So that means it has a protection of about maybe 97% or 96% for UVB. If you see UVA, PA++++, there are 4 pluses. 4 pluses means it's the maximum protection for UVA. UVA are a kind of ultraviolet light that causes a bit of skin irritation or dermatitis. And non-comedogenic, you can see non-comedogenic is there. It shows that it doesn't clog your pores. Very often, especially ladies and men as well, you go to work, you need to put on makeup. So I always tell patients, cleanse your face, moisturize, sunblock, and after you put your makeup. But If your sunblock blocks your pores, your makeup blocks your pores, the skin cannot breathe. It just simply cannot breathe. So it is good to have a sunscreen that is non-comedogenic, means your pores can breathe. And of course, in the market, there are many different versions of oral sunscreen. There's HelioCare, which contains fern block, which has antioxidant properties. So these are some of the ways to protect against the sun. The other thing I would like to say is, and just as a guide, the SPF value, if you want to convert it to how long it protects your skin, is actually from a very simple formula. So it's based on how long it takes for an individual person to have a sunburn. So if let's say you take about 10 minutes to have a sunburn, which means a bit of erythema, we call it redness, after being exposed to strong sunlight. SPF 10 means that you get 10 times 10, 100 minutes of protection. So it's just like that. So I think this is something that is important to know, because typically we would advise you to reapply your sunblock every 2 to 4 hours. So I know that's practically impossible, because you have makeup on top, you need to wash your face, you put it on again, wash your face, you put it on again. That's ridiculous. But scientifically, this is the duration that it protects you against. So you still have to use other methods like avoidance, sun avoidance, staying indoors between 10 to 2, which is the midday sun, which is the strongest in Singapore, to kind of reduce the effect of the UV rays on your skin. And on top of that, even visible light like this is a risk for me to have pigmentation. So it can also cause pigmentation as well. So if you look at this graph, you can see it is the SPF against the percentage protection. So at 30, the graph plateaus. So you can see that beyond 30, some patients say, mine is SPF 100. I'm better than SPF 30. But actually what it denotes simply is 100 times the time you take to burn. So 1,000 minutes of protection. So this is just a kind of a layman kind of guide to tell you that the higher the SPF, beyond 30, actually just denotes the increasing duration of protection. It is not really the increase in the amount of protection against UVB rays. And you can see over here, between 20 to 40 is already at 97.5%. So that 2.5%, it's not a great increase. So what are the other skincare products that the patients always ask? They say, doctor, is a toner very important? Actually, nobody knows in the public what a toner is for, So if you look at scientific studies and dermatological papers, a toner is actually not crucial, it's not recommended. But it has several practical uses. For example, it helps to control a bit of oil. On acne-prone skin, it also helps to form a base to remove your makeup, But other than that, no other scientific basis for a toner. So if you have 8 products, you have a certain budget, then you can actually take the toner out of the picture. Okay, eye, neck, and hand serums. This is what I always advise patients. If you have a bit of extra cash, you don't mind to spend to pamper yourself. The eye, back area, the neck, as well as the hands are the first areas to age in terms of skin. So if you look at a person who is in his 20s, who is in her 30s, 40s, 50s, you can actually see degeneration in these areas quite easily. There is a colloquial term locally said you can tell the age from the geleness of the neck as well as the hands. It's true, because you can actually see, how much guttering there is and how much dryness of the hands. It can show your age. So nowadays, we would recommend to take care of all these areas to hide your age. Okay? And there are many different serums. Serums with HA for hydration. Hyaluronic acid is very popular and very safe. Serums with alpha hydroxy acids for brightening of the skin. These are very mild peels. Now, if you apply and you feel that it's a little bit stinging, but you can see a bit of flaking, this usually would have some kind of fruit acids inside. I wouldn't suggest using this all the time, maybe in a week 2 times or 3 times, just to have a bit of exfoliation. And whitening creams with vitamin C, niacinamide, kojic acid, these are all very safe products to use to whiten your skin. So next we'll go on to the commonest conditions that I see at my clinic. Spots, zits, scars. Okay, so these are some of the topics that I'll be covering today. I'm sure all of you have one of each, something that you personally face. So for spots or pigmentation, there are many different kinds of pigmentation, and in fact, I would draw a comparison to doesn't mean 1 + 1 = 2. Sometimes the pigmentation can overlay each other. So you can have a bit of melasma with overlying freckles, with a bit of horis, you have the whole works. So how do you address all these issues? So one by one, okay, I'll explain very, very simply. Freckles, very common, run across the cheeks, over the bridge of the nose, commonly in Caucasians. These are actually the easiest to treat. But do you wish to treat these? Because nowadays there are cosmetic tutorials to actually make fake freckles. So do you wish to treat something that is actually going to be a beauty trend? I'm not sure. So maybe you can save your money on this. Lentigos, what are these? These are what you see on your mother or ama. Okay, so what is this? This is what we call sunspots. So sunspots are actually due to a couple of things. One of them is what we call sunspots, solar lentigens, or due to UV damage. There's also something called senile lentigens, which are due to aging of the skin. So there are different conditions. Horis nevus, you notice your girlfriend after she gets married, gets pregnant, have 2-3 kids, and whoops, I have 2 patches of pigment over the face, and they are symmetrical and they look quite dark, something like this. These are known as horis nevi. So horis nevus is very commonly, has a hormonal trigger, usually post-pregnancy, and they are very deep dermal pigments. So you need a specific kind of treatment, namely lasers, to treat this. No amount of topicals will solve this problem. Okay, and of course, dreaded melasma. So melasma is like a butterfly rash over the cheeks, and it looks a bit. It makes your face look a little bit dirty. Very, very common in Asian population, East Asian, Chinese, Koreans, Japanese, Southeast Asian, Thailand, and all this. Because our area is also the area where it's hottest. Okay, so this condition is very fickle to treat. It can be controlled, it cannot be treated. So you have to understand this point. So whenever you seek treatment, I always tell patients, if we can control it to an extent that a little bit of powder covers, success. But if you want it to be 100%, removed, then we have to kind of understand that it's something that is controllable, but not completely curable. Seborrheic keratosis. What are seborrheic keratosis? This is commonly known as lao ren pan in Singapore. It's a waxy substance over the skin. It usually happens when you're a bit older, between 40 to 80, all over the face. So these can be treated with some electrocautery or laser. So as you can see, there's so many different kinds of skin conditions, pigmentation, and some of them are actually overlapping each other. So you actually need a good skin doctor, either an aesthetic physician or a dermatologist, to explain to you what are the steps needed. And on top of that, you need to be diligent. A lot of patients is, doctor, I still have so much cream left. Then I said, but I gave you 3 months ago. I forgot. So, understandably, if you don't do the treatment, you're not going to improve. And not only that, sometimes the treatment can make your skin more sensitive, and you go under the sun. I go for Maldives trip. I come back, I look so dark. Then I come back and say, doctor, it's got worse. So it's actually, you need to go deeper to analyze what the issue is. Sometimes it's regularity of treatment. Sometimes it's what you do in your lifestyle. So the most important thing I want to emphasize is accurate diagnosis. Because there are many conditions that can mimic each other. For example, the lentigos and the seborrheic keratosis can mimic each other. So they can be wrongly treated. Many agents, we typically use hydroquinone. I think a lot of you know. Hydroquinone comes in preparations between 2 to 4%. Not to be used too long. Usually we limit it to between 3 to 6 months because of a risk of something called ochronosis. But very useful to help us to remove epidermal pigment, superficial. Oral medications, tranexamic acid, in Singapore we call it a whitening tablet. You take, you turn white. Okay, so what is this? This tranexamic acid is actually traditionally in higher doses used to control bleeding in cases of heavy menstrual bleed. But of late, the literature has come out that a low dose regime of half a tablet twice a day can actually help with melasma and give you whitening effects. In my clinic, sometimes I give patients, you say, oh, I need to go for a holiday, 2 weeks, very hot. I give a 2-week course, you come back, you look whiter. Oh my God, doctor, you are brilliant. Okay, so this is a way to overcome all these problems. Okay, of course, medical lasers. So what lasers are suitable for which condition? Actually, there are many on the market. If you go through your Facebook feed, pops out, this clinic has this clinic has that, and so many different methods. How do you choose what is good for you? This is a guide, okay? So just pay a little bit of attention so that you at least have a bit of knowledge on what is good for you and what's not. So freckles are on the surface. So on the surface, we just need a very mild treatment. For example, IPL. You can use IPL, pump, they turn darker. 5 days later, everything drops. Wow, I look so happy. Okay, we can also use something called a pigment laser, which I call a toddler drawing things on your face. Because what happens is you have this thing called an aesthetically dirty look. After you do a pigment laser, the face becomes black because all the pigment turns dark because they absorb the light. But after 5 days, you look like wonderful. So usually I would advise before you go for holiday, do it, come back, you look like a different person. Okay? For lentigines, they can span different layers. They can be on the epidermis, they can be on the dermis, or both. So you need actually a Q switch, which is the spectra, matte light, I think you all have some knowledge of this. And this is actually to target deeper pigment. For horis, don't waste time on your IPLs and all that. It doesn't work. In the creams, it doesn't work because it's too deep. So you need a Q switch. You need a long pulse, a 1064 to actually hit the horis. And you need multiple treatments done multiple times. On average, 8 to 10, easily. So this is something that you can blame your kids. You say, you see, you caused mommy to have this, this. Okay? Just kidding. And melasma is very common. I'm sure, that if you look at your moms or your aunties and all that, a lot of them have melasma. Even ladies in their 30s who have kids. So melasma has many triggers. There's a genetic trigger. Okay, there's also a UV light trigger. If you're exposed to a lot of sunlight, it can get worse. Pregnancy, hormonal triggers. Sometimes patients on Diane 35 tablets, or they put Depo-Provera or Mirena, IUCD. They have patches all over, and they ask, why is it so? It's actually due to a problem that is caused by a solution to another problem. Okay, so we have to go deeper into the history to understand what is the cause, and you treat the problem, then you will treat the condition better. And seborrheic keratosis is actually very commonly known as laurenpan. You just go to your local wet market, tons of this. So how do we treat? Use a bit of electrocautery, which is electricity, melt the waxy substance and wipe it off. Okay, and there's also a pigment laser, which again turns everything dark and it drops off. But pigment lasers tend to need more sessions because depending on the thickness, you're actually trying to remove layer by layer. So it depends on the thickness. You may need more than one session, sometimes 2, sometimes 3. So next we go on to zits. Oh, this is a perennial problem, but again, we have to make sure an accurate diagnosis is being made. If you see patients with just as a take-home message, how do you know whether you have acne or you have hair follicle inflammation or infection, known as folliculitis? The difference is you need to have comedons. If you have spots on your face and they are past, there's acne nodules, classically you think it's acne, you need to look for blackheads, whiteheads. If you have blackheads and whiteheads, this is acne. Okay, that's just a general guide on how do you determine whether you have an acne problem or you have a hair follicle infection. And there are many ways to treat acne. I'm sure all of you have tried, even myself. I have one zit right in the center here. It looks very ugly. But Benzac, you buy from the shelf. You try, it's very drying. Antibiotics, Dalacin, rub, it doesn't make sense. Retinoids, and all of these treatments, These are all that's available in the market. So, okay, how do we classify acne scars? These, they are broadly classified into what we call atrophic and hypertrophic. Atrophic means it's below the skin, the level of the skin. Hypertrophic means it goes above. So, ice pick, if you imagine a person using an ice pick and he hammers something in, you can see a very deep and very small scar. So these are called ice pick, typically on the nose, cheeks. Rolling scars is what you have usually on the cheeks, temples. And box scar is usually what you have, especially men, on the sides, very clearly demarcated. And what works? Have you all heard of Rejuran S? So in my practice, I tend to like to skew towards what we call mechanical methods. I used to use a lot of lasers to treat scars, but I realized that lasers, you need multiple sessions. It's very common to see a patient needing to go 5 to 8 sessions before you see any improvement. Things like the carbon dioxide laser, if you do 2 to 3 times, what you see is whitening and a bit of smoothing, but the scar is still there, you see. So what I recommend is to do physical methods, which is subcision with a needle, and injecting something called a healer, a Rejuran, for example, polynucleotide to heal cause collagen remodeling to heal the scar. Chemical peels, like a TCA cross, such as here, we can actually drop very concentrated chemical peels into the ice pick scars. They will cause frosting because there's a reaction with the epidermis. And because of the damage, there's collagen remodeling and the scars will shallow out. And medical lasers as well. There are many on the market, carbon dioxide, CO2, erbium, what have you. And nowadays, the latest would be something called a pico laser. So what is a pico laser? It's just a very, very short wavelength laser that is non-ablative. And what it does, it can cause what we call laser-induced optical breakdown, LIOB, holes inside the scar. So we are actually doing what we call laser subcision. Instead of using a needle to cut, we use a laser to do that. The skin surface is intact. You can put your makeup and cover. Okay, so this is my bread and butter, aesthetic procedures. Okay, first and foremost, Botox. I would like to take this opportunity to explain this is a very misunderstood product. Okay, so Botox is actually produced by Clostridium botulinum, which is a bacteria. The main uses in the past is to treat spastic muscle conditions like blepharospasm, torticollis. Sometimes babies are born like this. You see. So what is it used for? It's used to relax the muscles of facial expression to improve the appearance of lines. So what happens when a person who's very smiley all day, after a few years, you see this, they come out. The person who is very serious all day, he frowns, you see the 11s come out. So this Botox is actually used to relax these muscles so that you prevent the onset of lines. So the question is, how much will I become dependent? Will I become addicted? These are all the questions that people ask in the clinic, which I will address later if you have any questions in the Q&A. But we can also treat sweaty palms. We can treat facial oiliness. We can reduce pore size. We can reduce enlarged calf muscles called cankles. So if you wear high heels and you don't look good, you can actually use Botox to reduce it and have sexy calves. So it's many uses for Botox. And fillers, as the name suggests, basically is used for filling of volume loss of the face. So there are two kinds, HA and collagen biostimulators. All these are the brands. And as you can see, so many areas that you can inject fillers. But the problem with all these procedures is you need to find a good and experienced procedurist to do it. There are many disaster cases where too much filler was injected, incorrect technique was used, wrong filler was used, and leading to long-term complications. Recently, I had a case from China who they referred to me, and she injected fillers in the neck to remove the horizontal necklines. And it was very good for approximately 5 to 8 years. And what happened after that? Lumps started to appear. Okay, and if we go deeper into the history, then she asked the Chinese doctor, "What did you inject?" He said, "Oh, I did Ruilan, which is Restylane." But actually, that was not what was injected. Aomeiting was injected, which is polyacrylamide. So there are a lot of substances which are banned and approved. You need to know which are banned and which are approved. In Singapore, I would advise stick to hyaluronic acid fillers, HA. And you can use other approved brands like Radius, Sculptra, Elance, and Rejuran. These are all approved. Okay, peels. Have a look at this patient over here. You can see that the face, that's what we call frosting. So it's turning white. So what is this? It's actually the reaction. It is a sign that shows me that there's the reaction between the peel and your skin is complete. That's it. And what happens after you apply a peel, you see there's this rosy cheek appearance. And after like a week or so, it will start, 5 days or so, it will start to peel for a week. And then after that, it will stop. So the peels have been around for a long time, 10, 15, 20 years. And they work. So if you have a multitude of conditions and you don't know where to start, a peel is actually quite good, especially if you have oily skin. So this is something that can be considered. For lasers, tons of lasers on the market. Korean lasers, Chinese lasers, US lasers. Tons of them. But you have to understand the concept between what a laser does. So it's broadly divided into ablative, non-ablative. Ablative means for scars and resurfacing. So what it does is it actually causes a very shallow ablation of the skin, as you can see over here. For fractional resurfacing, it's also using ablative lasers, but it's a newer method where we treat the skin in fractions. When you say fractional lasers, it means you treat the skin fractions. Imagine there's a square, and in this square, there are multiple columns of treated areas. And in between these areas, there are columns of normal skin. So this was invented so that you can achieve the